One part of thriving with an MPN is finding a treatment approach that manages your disease, the symptoms of your MPN, and that fits with your lifestyle. So, what are the factors that are considered when choosing treatment for patients with ET, PV, and MF?
Certainly the goals of the therapy. So is the therapy one that I would be looking to maybe delay progression or for long-term potential benefits? Or is it something I need now to control short-term risks such as blood clots? The goals of the patient, because some therapies may be more suitable to the goals of one patient than another. And the other, there's clinical features that kind of may push towards one approach versus another. Certainly, in a 20-year-old patient, I'm thinking about fertility. I'm thinking about, normal life expectancy. In a 90-year-old patient, I have a different set of concerns, multiple medications. What, am I going to do that might, be affecting their other comorbid conditions? I think about what are my near-term and long-term goals. So obviously age becomes a factor there. If I'm 95 years old, no matter what I do, that person is not going to live 20 years. If that person's 20 years old and they're not living, 30, 40, 50, 60 years, that's a real shame. That's a huge loss of life. So that helps kind of point me in one direction or another. And then there's different types of therapy. There are injectable agents, there are pills, there are drugs that have been used for a long time but don't really have an FDA approval. There are drugs that are approved for certain indications, and as physicians, we can sometimes stretch that a little bit based upon clinical judgment. So I think a lot of that goes into the discussion I have with patients about therapy. And that's always, I present to them what the options are, what I think the benefits might be, what the potential toxicities are, and then we discuss.